Welcome to another episode of Marketing Tips for Doctors. I'm your host, Dr. Barbara Hales. Today, you're in for a rare treat. We have Dr. Corey Malnikoff here with us. He is the CEO of Palmer Care Group, a healthcare organization operating 24 chiropractic clinics across the whole United States. He is an entrepreneur, speaker, and leader known for building high-performing teams, scalable systems, and world-class patient experiences. Today, we're going to dive into what actually works when it comes to marketing for doctors, how to attract the right patients, grow your practice, and build something that truly scales. Welcome to the show.
Thank you for the introduction. Always fun to hear all of that in one one share. So thank you.
When you first started out, did you see patients at that time?
Yeah, no, I've been in practice for 21 years. I saw patients probably up to about 7 or 8 years ago. I had about 10 clinics at the time. And so I was a full-time guy. I loved seeing patients that they literally had to kind of rip it out of my hands for me to stop. But I kept cutting back. I went from full time to Monday, Wednesdays, and then just Mondays. And then I think I got to the point where I had a patient laying down. I was listening to what my doctors were saying. I was listening to the front desk. I was thinking about the other clinics, and I just felt bad for not being there 100% for the patients. And so, yeah, it's been probably 7, 8 years, and I've been running the clinics instead of in it, but I was there a long time.
What made your practice unique in compared to other chiropractic offices around? Did you have multiple streams of income? Where were there additional services that others didn't provide? Were there products that you felt your patients
Yeah.
could use? Like what is it that made you different?
Yeah, and I will say, with 24 clinics, when doctors are into different things, we do have all sorts of different techniques and instruments and things that we use on patients. But really, what makes us different is I always tried to create this atmosphere. I was a big Starbucks junkie in the beginning, and I was trying to open a practice, and I thought I'd graduate, put a shingle up, the Red Sea would part, patients would line up, I'd take care of them. And the reality, like most entrepreneurs find out, is you open up and then, nothing. So I studied a lot. I studied Amazon, I studied Nordstrom, I studied the Ritz, I studied Disney, and I studied Starbucks. And Starbucks talked about how Starbucks was meant to be the third home, right? You had home, you had work, and then Starbucks.
But
And
no,
I
but
thought,
no drive-through, right?
right, exactly. No drive-through. Uh, but I thought, a chiropractic clinic, a wellness clinic should be the third home, not Starbucks. And so I kind of wanted to create this atmosphere. And I was always really big into personal and professional development for my doctors, for my staff, and even for my patients. So we tried to build a place, and we always talked about when patients come into our place, if their anxiety is high, we're going to lower their anxiety to peace. And if their energy is low, we're going to bring their energy up. And so for us, it was all about the experience. The second you walk through the door, the way you were greeted, the way you were treated, the way your case was managed, and how we kind of had an impact on every aspect of your life, emotional, physical, chemical, and treatment. And so that was the goal. And for me, that's what's made us different. It's just the culture and the place we created.
That's wonderful. Now, before you had your first offshoot,
Mhm.
you must have been a little bit nervous about doing that. Would opening up another
Sure.
location divide my patients, or would I succeed? Walk me through that and how you did succeed.
Yeah, I had no intentions of having 24 clinics. I had every intention of opening one clinic and trying to make it as successful as humanly possible, being a big part of the community and making that who I was. The reality was, I opened a clinic, didn't know what I was doing, figured out what I was doing, and then very fast grew it. I had been renting a room while I was waiting for my clinic to get built from another chiropractor. And when he kind of saw how fast I built it, he said, my friend is selling a practice. I'll go buy it. I just need you. You can be 50-50 partners, no money, and you just fix it. And so that second clinic was just kind of like I couldn't do anything else in my current clinic. My wife was about to join me, so we couldn't fit any more patients there. So the second clinic was like literally completely unpredicted. Um, but man, it was fun. I got to drive down. I was about 45 minutes away, go to this clinic that was, pretty much failing, and then take it from where it was and grow it up. And so, yes, it was scary. But I'll tell you, the scarier step wasn't that second one because the first one was successful. The second one was just fixing. But I went from two clinics to four clinics in a blink. And the scary part of that was, I had no money, and then I started to make a little bit of money. Then we got the second clinic, and then I started to make a little bit more money. And now I got four clinics, and I have negative money. So that was where I learned about the scariness of expansion. When you want to expand and you want to scale, you have to be willing to step into this world of fear, where you're going to take a few steps backwards before you step forwards. And that's kind of been, not to go off subject, but that's been the whole thing, right? I went from money to no money, and then from four clinics to 10 clinics, where I went way backwards, and then got caught up, and then from 10 clinics to 20 clinics, and every time we make a massive growth, now I have to expect that fear and expect that, and just be willing to make that jump and be prepared.
What's really interesting is I think many people hearing your story would think, well, by the time you got to the second or third one, you had it down and it was just going to be gravy after that.
Yeah. No, it changes. Five clinics is you, right? I can see patients full time and still have my fingers on everything. But 10 clinics, it's not me anymore, right? There has to be a C-suite. There has to be an infrastructure that I built and pay for people to run our systems and to run our marketing and to run our HR and to run our everything. So with every clinic you add, you are limiting your ability to accomplish the job that you would normally do. And now you have to replace yourself with somebody who is paid and trained by you. So it's a learning curve because none of us, on this podcast, I think your listeners, the doctors, none of us are trained entrepreneurs, trained businessmen, trained businesswomen. We just have to learn as we go and study as hard as we can, and all of it's a learning curve, but it's a fun ride if you take it.
When you started realizing that other people would be taking over the roles that you once were actively doing, did you feel bad about it, or were you just so excited that it didn't matter?
No, no, no. You don't want to let go of those. You grip them, death grip those. Not only do you not want to give them up, but then you have to learn very quickly that you can't micromanage, right? So like I'm going to allow you to do second interviews and decide if this person has the ability to do the job, and I have to be able to like not give my approval on every employee that gets hired, and that is a very difficult thing to do. So no, every step along the way, every time you hand something off, yes, you watch it a bit in the beginning, but you have to have the ability to not watch it if you want to grow, and that's very difficult.
How long ago did you first do your expansion?
Well, honestly, the second clinic came like 3 or 4 months into practice because we grew just really fast, and then it wasn't until about 2 years later that I brought on the next two clinics, and then waited a year for the fifth clinic, and then I went from like five to 10 in like maybe a year or two.
Yeah, but like
Um,
what year was that when it
oh
all?
yeah, so 2005 is when I first started practicing.
Mhm.
So it's been 21 years, opening up 24 practices. I'd like to say we opened one, each year or so, but the reality is, we typically opened about five at a time.
So when physicians hear your story and they say, "Oh my God, I want that," um, how do you how do you advise them when they say, "Oh well, in those days it was easier, and now it's harder. It's a different world. I can't do it." So what would you say to them about that?
Yeah, it's probably one of the biggest things I get, text messages, emails, questions about. People are like, I'm ready to open my second practice or third practice, and what do you think? And so the advice I always give everyone, because the reality of the situation is, it is true. Most people that go from one practice to two to three go back to one. That's just typically how it goes. And the reason is really simple. You have to have your first practice. Your first practice has to be so successful and you have to be so okay with your income that when you open your second practice, that the first practice can handle all of the expenses for your second practice for at least a year and not, bankrupt you, cash flow you. It has to. You have to have such a successful first clinic that it can do that because you just don't know. With everything you don't know if it's going to replicate. You don't know how you are as, a manager of the people that are in front of you versus a manager of the people that are in another location is a whole nother game. So you've got to have such an amazing first clinic. And then, the second part just becomes you've got to be able to get your systems into a written down way. Now all of mine are digital. And then marketing, which, your podcast, marketing becomes everything. And, with 24 locations, I can tell you, you've got to get good at everything inside of marketing because, what I can do in Texas is completely different than the way I'll market some of my clinics in Northern Virginia. So you've got to kind of have your fingers, you got to be excited about marketing. You've got to always be learning new things and you've got to always be willing to pivot.
Well, what is working these days that you have found in marketing your 24 locations?
Yeah, so there's so much, it's never ending. I mean, you know this with all the people that are on this podcast, there's just so much great stuff out there. But it really, for me, becomes very dependent on geography because digital marketing is absolutely amazing and it is so deep now. I mean, yes, you can do Instagram posts, Facebook posts, LinkedIn posts, Twitter posts, YouTube posts. There's Google posts, there's Google ads, and all that stuff works amazingly. You've got to learn all of that and use all of that. But there's some geographies, like I have some geographies in Texas that have such a congested digital footprint, like so many people in that congestion that the ROI and the responses for that, there's no way I could scale clinics there if that was what we did. So like in Northern Virginia, I'll spend a lot of money on Google Local and Google Ads and on boosts on some of our social media so that would become very well known in the neighborhoods versus in Texas, what works very well is being out in the community, meeting all the professionals that I can refer to and that can refer to me, that are doing health screenings at different health fairs, that are doing lunch and learns in different companies. And so we use all kinds of tactics. Now, do I also do some digital marketing in Texas? Of course, but I don't spend a lot. And do I also do all the other things in Northern Virginia? Yes, but I don't push it a lot. You've got to figure out what's working. I think when I talk to people on the phone and they're trying to get their marketing to work, I think part of the problem is they've got 15 different things going and then these don't work, so they try this, and this doesn't work, so they try this. You got to focus in, and if somebody else can get this marketing to work in your area, so can you. So instead of quitting it, dive into it. Learn why it's not working, what you can do to make it work.
Absolutely. And, people are so, scrambling for AI in their practice
Yeah.
without realizing that some of the old school techniques really work the best, and that it's not something that they should forget about. People, after all, want to have a relationship with you. They want to actually see you, talk to you, and hear what your views are. So, getting out there and introducing yourselves to people, both prospective patients, but also to physicians in the area that can refer to you.
Yeah. Doctors and professional referrals. I mean, we talk to this about our doctors all the time. If the only thing you did was have two lunches a week with referral partners and you did that every week, you'd have 104 lunches a month. And if 10% of those people like you, that'd be 10 people sending you patients every month. So there's professional referrals is one of the most amazing things. I will say old school. It's kind of funny because we just started doing some postcards again. Now that's from like a decade ago. I'm gonna
Mhm.
tell you the response in some of our areas on like these postcards is insane. So there is some old school stuff. But
Well, who doesn't
have
want
you?
to get a card in the mail that says happy birthday?
Yes, yeah, yeah. There's lots of great stuff. But and AI, right now, by the way, also, I mean, I know everybody wants to dive into it, and I think they should. AI right now is the wild, wild west because nobody knows for sure, but we do know that feeding it and doing, AIO, doing the search engine optimization, which is now for AI, is absolutely amazing. I think if I can give one piece of advice on something like AI and even social media marketing and things like that, I think that doctors, because we want to be doctors and not we don't want to be the professional marketer, too many times doctors will go out and find this is the best company to do AI marketing for me. This is the best company to do lead generation for me. And they like hand it off and forget it. So the one thing I would say is you've got to learn it, right? And it's not that hard. You can jump on YouTube and say, put in a video, teach me how to do AI SEO. You can go into ChatGPT and just say, tell me the top 100 things I need to know. You really have to learn how to do it. So I always like lead generation AI. I learn how to do it to the point that I'm dangerous enough that I could do it, and then I don't. And then I hire a company because then I can watch what they're doing and I can make pivots and I can give suggestions and I don't just take the results for what they are. So get into AI marketing, get into all this stuff, but for the love of God, know what you're doing first.
Absolutely. How actively involved are you in creating videos for your patients on the sites?
uh, I'm actively involved and by that I mean like maybe twice a month I get with our social media people and they shoot videos with me. Um, so that's about as active as I am, and then they do all the editing and posting and everything for group, which is kind of the umbrella. The individual clinics is me giving them what I want them to record and do, right? And then I have a separate crew that then edits and posts those. But at the end of the day, I'm really just looking at how many posts are we doing? When are they going up? What are the statistics? What are the results? So I'm all KPI driven.
That's great. So, what advice would you give to our, you know, physicians and chiropractors
Yeah.
that are listening today? Like two pieces of advice that they could implement right away.
Yeah, yeah. Well, number one, when I talk to chiropractors and they're like, I don't have enough new patients, or I talk to functional medicine, or I talk to any of these guys and I don't have enough new patients, right? And then it's I don't have the budget for it. Because there's so much stuff that's free. You can right now shoot videos and post it on 6 different platforms. You can right now go stop by an office and drop your cards and meet a professional. You can right now go bring bagels and coffee to a bank before they open, introduce yourself and tell them about your clinic. There's so many free things you can do right now. If you don't have enough new patients, it is just because you are not trying hard enough. It exists. You just have to do it. And no one can make you do it. But you could post 50 posts on social media right now if you wanted to, right? And talk about who you are. Talk about what you do. And your community will absolutely love it. And then, the only other thing I would tell you is, have a goal. Like, okay, I don't have enough new patients for the love. Like, what is enough new patients and why did you pick that number? Like, and if that's your number, give me the action steps of how you're going to get it. So there's a million ways to get new patients, right? If you're stuck and your brain is like, I can't come up with one, then go on ChatGPT and say, give me 25 ways to get new patients right now that cost me nothing and then you can do it, but work towards a goal, right? Say, I want 27 new patients this month, and here's the action steps I'm going to do. You do those two things. I just don't know how you can't have enough new patients.
Do you have a program yet on how to instruct physicians to follow in your footsteps?
Yeah, that's a good question. No, right? So we have all the programs for all of our doctors and CAs. For me right now, it's just that there's so many people that reach out about what we're doing. My thought process was let me just give it out for free. Let me answer any questions. There's really nothing for me to gain from this except for, hey, doctors are helping a whole lot of people. I want you to help a lot of people. I want you to do more. And if I can be of any help for you to do that, then do it. Use me.
That's wonderful. So, what else would you like to tell our listening audience that maybe I haven't touched upon lately, yet?
Well, your podcast is marketing. The only other thing I'll say about marketing is this. I've always looked at marketing is, if you love what you do, if you absolutely love what you do, then marketing is just your extension of your love for what you do out into the community. And how many different ways can you come up with doing that? And if that's what you're doing, if the only thing you're really doing is sharing what you love with the community because you know it will make an impact, then all of the negative things that we think of when it comes to marketing, the sales process, the I don't want to do this, I don't want to do that, all that goes away. Because the second you are locked into all I want to do is help, then that's all you're ever doing. You're just offering your value. And because it's coming from such an authentic place, it works. It just works. I used to go out to health screenings, and my goal was I wanted to meet one person that I could show them an alternative to maybe a surgery they were doing. And because the only thing I was doing, they were sitting there talking to people about health and wellness, I ended up with all these new patients. It just has to be authentic. You just have to figure out why this means so much to you. And then all you have to do is share that. And that's all marketing is. It's just you sharing who you are with the world.
That is wonderful advice. And with that, I would like to thank you for coming here. And
Thank you.
listeners, this is, a great guy, as you have seen and heard. And his company is called Palmer Care Group, and you can reach out to him at palmercaregroup.com. We'll also have that in the show notes in case you don't know how to spell it or you promptly forget it as I have said it. But, this guy has some great moves, and you need to see what he's done and follow along. If you do that, there'll be bumps, but you know what? You're sure to meet with success. So thank you so much for being on the show today with us, Corey.
Thanks for having me.
This has been another episode of Marketing Tips with Doctors with your host, Dr. Barbara Hales and Dr. Corey Malnikoff. Till next time.